if we look at the anatomy of the bladder can be divided into the apex, the body, and the neck. The trigone, which we refer to quite often, is a triangular area on the dorsal aspect of the bladder where the ureters are going to come and implant, and they will open there to fill the bladder with the urine.
In stage B, we have a low risk and a high risk group. So stage B1 is the mitral valve disease dogs with no cardiomegaly. And stage B2 is the mitral valve disease dogs with cardiomegaly. So based on the recent consensus statement, the left atrial size is 1.6 times the diameter of the aorta. And if you're doing a little bit more involved echocardiography, then the left ventricular internal diameter normalized for body weight should be greater than 1.7 to call them stage B2. So we look at both those measurements in our clinic to say whether a dog has got significant cardiomegaly or not.
So there are two mechanisms for achieving blood flow during closed chest CPR. The first mechanism is called the cardiac pump, and this is where we apply compressions directly over the heart, and it's that compression that moves the blood through the valves within the heart and around the body. The second mechanism is called the thoracic pump, and this is where we do compression over the thoracic wall. And this in turn causes an increase in intrathoracic pressure, and this causes the great vessels to collapse and refill, and that's what moves the blood forward.
So parenteral nutrition is something that we are able to offer to the patients as well, and this just means that we're giving them all of the glucose, the proteins, the fats and everything else intravenously rather than enterally. And we would use this if they're unable to meet the daily RER enterally. So if we've tried the bolus feeding, we've tried the CRI, and they're still not tolerating it, so we can move on to this. And we can either give them 100% or even just part of the calorie requirements this way.
Feline intracranial meningiomas are the most common brain tumor type in cats, and they are often round or oval, fairly firm. In this case, the T1 post-contrast MRI showed actually quite a good contrast uptake, unlike in the cat I showed you earlier. And you can see that this tumor is about 1.5 centimeters in diameter. And they are, again, relatively easy to remove surgically. Prognosis is good to excellent. And in a recent study, which included 121 cats, the median postoperative survival time was 58 months.